My guest has learned a great deal about public health through her administrative support role within a public health organization. You're listening to the PHEC podcast, episode 215. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. This episode is part of a special sponsored series of episodes where you'll learn about the Tribal Epidemiology Centers, often referred to as TEC, through my conversations with public health professionals working within the community at each of the centers. On this episode, you'll learn about the Alaska Native Epidemiology Center, which was established by the Indian Health Service to assist the National IHS Epidemiology Program in improving the health of Alaska Natives and American Indians. The Alaska Native Epidemiology Center has 4 core functions: data sharing, technical assistance, disease prevention, and surveillance. Now, back in episode 180, I interviewed Audrey Juliuson and Jordan Scan from the Alaska Native Epidemiology Center. They each shared their journeys into public health and discussed their roles there as well. Now, I'll share the link to that particular episode on the show notes page for this episode, just for quick reference. Now, on this particular episode, you'll meet Annie Okpealuk, who works at the Alaska Native Epidemiology Center as well. And as a part of the administrative support staff for the National Coordinating Center and the Tribal Epidemiology Center Public Health. She joins us to share more about her role as well as her perspective of public health and the impact of the Tribal Epidemiology Centers on the tribal community in Alaska. Let's connect that conversation with Annie right now. Well, I'm excited to introduce you to my guest on this episode. Hi, Annie. How are you? Welcome to the podcast.
Hi. Hello. I'm doing good.
Thank you for joining me. I know it's early in the morning for you. It's afternoon for me, but I'm really glad that you got up to join me for this episode. Why don't you start out by just telling everybody a little bit about yourself?
Oh, okay. I'm Annie Okpealuk, and I'm half Athabascan and half Inupiaq. My mother's side of her family comes from Stevens Village, which is the interior of Alaska, and they're Athabascan. My father's side comes from the northwest, from the Teller region, which is closer to Nome, and they're Inupiaq. I'm a single mom of 3 children. I have 2 daughters and 1 son. My daughters are Gwen, Caitlin, and my son's name is Sebastian. They're going to be 9, 8, and 3 this year. Their birthdays kind of fall within 1 month of each other, October and November. So,
birthday season.
Yes. We recently rescued a dog. She is 3 years old. She's a Husky Chihuahua mix from St. Michael, Alaska. And we named her Blueberry.
Love that name.
Currently, right now, I'm working on my degree in accounting. I'm attending the Southern New Hampshire University online, and I think I should be done in December of next year.
Well, it's exciting.
Yeah.
Not the accounting part, but at least not for me. That's probably my least favorite part of, even as a business owner, that's one of my least favorite parts of things that need to be taken care of. I have a bookkeeper and an accountant. But I have a lot of respect for people who really enjoy that area. My son actually has his degree in accounting, and he feels the same way about the health. Anything related to health is not his thing, and he doesn't want to have to deal with it. So, but I think that's great that you have a passion for accounting. So, and I love the dog's name, Blueberry. That makes me smile.
Yeah. Her foster parents were calling her Berry. The name that she was given before was Bear. I was like, no, she doesn't look like a bear. She's a blueberry.
That's nice. So I'd love to know this first question, I guess I'm going to ask is one of my favorite questions, because I always am curious to know how people work their way into public health. How do they learn about it? How do they just get involved in working in public health? So when did you first learn about or become interested in public health?
Well, honestly, to give a little more background, I used to be a medical biller, and I did that for, oh goodness, I think about 6 years. And then I switched to substance abuse, mental health billing. And it wasn't until I went back to work after being a stay-at-home mom for 2 years that I saw a position opened, Alaska Tribal Health Consortium, as an office specialist. And I saw the department name, and it said Alaska Native Epidemiology Center. And I opened it up, read the description. It was very easy. It was stuff that I already knew how to do. And it wasn't until I started working at Alaska Native Epidemiology back in 2014 is where I learned about public health. I knew nothing about public health. Honestly, I thought that the epicenter was also, dermatology and the epicenter of an earthquake.
Oh my goodness. Now I'm going to tell you that every epidemiologist listening here is chuckling because we are often confused with dermatology. And I'm thinking maybe because it sounds like it has something to do with the skin, like dermatology,
Yeah.
We're trying to figure that out. But tell me more about the Earth epicenter.
Alaska has a lot of earthquakes, so of course I sign up for the news feeds and alerts for when an earthquake happens. And when it shows up on my news feed, the little report says the epicenter of the earthquake was this many miles from Anchorage and this many miles deep. So it was very interesting to me to learn that.
Yeah, we were talking for a bit, before starting the recording, and at first I was like laughing. So you thought you were going to be working in the earthquake epicenter?
Yes.
But at the same time, I'm laughing a little bit, but at the same time, that points to, I think, an opportunity for us as public health professionals to be more clear in our communication, and also how public health general information should be explained, expressed, relayed more clearly for reasons just like that. I mean, that's easy for most people. I would have thought the same thing. But then you also tell me how long did it take for you to realize that you weren't working in the earthquake epicenter?
I would say within the first month I started working.
You're like, okay, so where are the earthquake alerts?
Yeah. It was one of those questions I didn't want to ask. I was just observing, listening.
Yeah. I'm chuckling, but at the same time, very serious, because that is something that we, meaning sort of the people that are inside public health and have trained and and studied and worked for a long time, there are a lot of things that we kind of take for granted and think that it's public knowledge or general knowledge, and it's not. And we just need to be really clear in our messaging. So I won't harp on that lesson, but I couldn't resist.
Oh, yeah.
So describe the work that you are currently doing now.
Right now, I'm the senior office specialist to 3 grants within our department. They are the CDC Infrastructure A, which is called TechV, and the CDC Infrastructure B, called NCC, and our main core grant, which is the Epicenter Core. And I do like administrative tasks. I purchase items. I maintain the purchasing records. I submit contracts. I follow up with contract invoicing. I do travel expenses. I coordinate travel. That's when we used to travel, by the way.
Yeah.
I am also coordinating trainings, meetings. I assist with conference coordination. That's been a while since the pandemic. Right now, one of my projects that I'm trying to work on and complete by the end of the month is creating a standard operating procedure for our administrative filing expenses and labeling expenses.
So I'm wondering, since you mentioned this about, the pandemic and most organizations have shifted to online conferences and using those virtual platforms, is that the same for you? Are you finding that you're organizing more online trainings and conferences now?
Yes. My first online training that I had to organize, to be honest, I put off learning things about Zoom all the way up to the day of this training. The training actually happened back in November of 2020. It was the first training of FY21. It was the tribal grant writing, virtual tribal grant writing. I had to switch from, in person to online. So I had to purchase different things within Zoom, understanding that the attendees who registered for the training live in rural Alaska, so their internet connection and bandwidth is very poor. So I had to purchase the toll-free online for Zoom for people to call in and still use their webcam for the training.
Yeah. And also, is this for employees of the tech, or are this for folks in the community that are attending these trainings?
Most of the trainings that the Alaska Native Epidemiology host are for the Tribal Health Organization, or THOs, is what we call them, partner sites, other ANTHC staff, sometimes us, our department.
So give me an example of a tribal health organization, like a partner. Like, how do they partner with the Tribal Epidemiology Center? Are we talking about, just describe that for me. I'm curious. I'm thinking my audience might be a little curious too.
Since the Alaska Native Epidemiology Center is part of Alaska Native Tribal Health Consortium, Alaska ANTHC is the largest hospital or organization within Alaska. So our tribal health organizations, or THOs, are all of the other regions within Alaska. For instance, Arctic Slope, which is the northwest region of Alaska. A tribal partner is also referred to as like a sub-awardee, where they're working on a certain grant with us.
Okay.
Within their community. For instance, one of the most recent grants that was awarded to the Epicenter was related to the colon rectal cancer screening program, or CCRC. They have sub-awardees with our Norton Sound Health.
Okay.
So what they're doing is they're working with their community in their region on the grant deliverables for that grant.
Okay. That makes sense. And I would imagine this allows the work that the tribal epidemiology center is mainly focused on to go through the partner and then like better reach the individuals in the community.
Correct.
So, in your own words, nothing tricky, but in your own words, just describe how or why you think epidemiology is important in the work that, you do in the community that you serve.
Like I said before, I thought the epidemiology and dermatology were the same thing, but they were two different things.
Mm-hmm.
It's important because the Alaska Native peoples need to understand, epidemiology is important because it's a scientific, systematic, and data-driven. They show how diseases occur within different groups of people, like the CRC grant, or within our country, state, village, or neighborhood. And it's just something that's not really commonly known within the state of Alaska.
Yeah, I think that goes beyond the state of Alaska, and I could say that that's broadly around the world. Even within the industry of public health, of professionals that are trained in public health, there are folks in public health that don't really understand epidemiology, don't really kind of shy away from that. So,
oh yeah, that's true.
Yeah, it's not just, I don't have to feel bad or feel isolated or anything. I just think that part of what I like to do and even having the conversation on the podcast here and have it in the title is because I want more people to understand and feel more comfortable with it and interpret whatever the meaning is for themselves. And, I don't really look for textbook definitions all the time, but really what does it mean to you and how do you apply it? So I think that a lot of, it's not commonly known, not just in Alaska, but even from where I see it here and for my colleagues and local communities.
It also does not help that media or movies, when they do a theme of like outbreak, they say, send in the epidemiologists. And they're like going in with like their coats and bags and just like, no, that's not what they do. Well, yeah. Not all of them.
Exactly. I did a whole episode on that. Like, what's a typical day of an epidemiologist? And typical is in quotes because there is no such typical. There are so many, an epidemiologist can look very different from industry to industry in different focal areas. So yes, you make a very good point. I'm going to ask you, I really enjoy, speaking with you and just hearing your perspective about public health and what you do with the tribal epidemiology centers and just the community, filtering through that, through your lens. So I'm going to ask you just one final question and as we kind of wrap up here, but what advice or tip would you give to someone listening who, they could be a student, graduate, or anyone listening to the podcast is just generally interested in public health? So do you have any bit of advice for anyone listening in terms of a career in this field?
Yes, actually. You don't have to be an epidemiologist, a statistician, or a biostatistician to work in public health or specialize in public health as a career. For myself, I'm in admin support for public health grants. And, it's beneficial for the administrative support to have a general background and knowledge and the understanding of what an epidemiology center is and their grant fundings are. Because that's just one area that people tend to forget. When you're applying for a grant, you put in a statistician, an epidemiologist, a public health specialist. And once you get awarded the grant, you start working on the grant, and then it comes down to, okay, I need to manage, the monthly expenses. I need to purchase this. I need a contract for that. And it's just like, we don't know how to do this, We need to ask somebody else to help us. So,
yes,
writing in an administrative support on the grant is very beneficial for the grant.
You are absolutely right. I hear it from as I interview a lot of public health folks, but I mean, it's so true when you have all the people with the titles, writing the grant, getting the grant, but there has to be that strong administrative support and, all the things that you've mentioned in your description. I love how you support the organization. You have the connections to the community. You bring a very important voice to the table. So I also really like how you are able to connect the dots for yourself. I mean, you see the importance of what you do in this public health organization and understanding epidemiology and being able to, even if you've just recently grasped that understanding, it's wonderful. It's important that you understand it as a part of the team. So I love your perspective. I appreciate you for sharing that.
Oh, you're welcome.
Well, I'm going to just wrap up here and just let you know that I appreciate the work that you do. I appreciate that you took some time to meet with me. We've got such a big time difference. I appreciate you taking the time to meet with me to share your perspective and your experience and what you do and those transferable skills, the strong grant writing experience and background you have and their work on your accounting degree and all that you'll be able to continue to bring to the table and support the Tribal Epidemiology Centers. I just appreciate you. So thank you for being here. And I really hope you enjoyed the conversation.
Oh, I did. Thank you so much.
You're welcome. I'd like to thank Annie for coming on the podcast and for sharing her work with the Alaska Native Epidemiology Center. I can appreciate the way that she knows the value she brings to the team and how she has learned so much about public health through her administrative support role. If you would like to learn more about the Tribal Epidemiology Centers, then just visit the show notes page for this episode, which is episode 215. Go to phecpodcast.com and from there navigate to episode 215. Remember to subscribe to the podcast. If you're on our website, you can simply follow the podcast, click on the subscribe from the homepage or the podcast page. And if you're using one of the podcast apps, if that's where you're listening, then just make sure you click the follow button somewhere in that app so that you can be among the first to hear the latest episodes as soon as they are released. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.